Hi, my name is Samir Damani. I'm a cardiologist and founder at iThriveMD. Today in healthcare, we intervene far too late, when the disease burden is very high and the ability to reverse disease is low. If you're young or mostly healthy and numbers start to drift, you're often told, you're fine, come back when it's worse, or just diet and exercise. But disease doesn't happen suddenly at a specific lab value. An LDL 130 is not where cardiovascular disease starts, and a hemoglobin A1C of 6.5 is not where metabolic damage begins. In fact, by the time you cross those thresholds, the metabolic derangements that lead to diabetes, heart disease, cancer, dementia have been unfolding for years and maybe even decades in many instances. And it's often at that point way too late to reverse the damage. So we need to target these disease processes far before you hit a clinical definition or laboratory diagnosis of disease, because that is when the body's primed for prevention and the ability to reverse any damage is much higher. Today we have advanced biomarker panels and testing like whole body MRI and coronary angiography that can identify disease at its earliest and most reversible stages. By using these tools as an early warning system, we're not just spotting problems sooner, we're then able to directly target the three main causes of chronic diseases. The first of these is chronic inflammation. It's what scientists are now calling inflammaging, which is basically a slow burn in the immune system where instead of turning on to fight an infection, your immune system stays mildly activated all the time. Over years, this accelerates plaque buildup in arteries, worsens insulin resistance, disrupts hormones, and increases the risk of conditions like heart disease, diabetes, Alzheimer's, and many cancers. Second is dysfunction of the mitochondria, which are essentially the power plants of your cells. And when they're not working properly, you see more fatigue, brain fog, reduced exercise capacity, weight gain, and cognitive decline. And finally, the third major driver of aging is progressive decline in DNA and cellular repair systems. Over time, this allows everyday wear and tear and metabolic waste products to then accumulate, leading to stiffer tissues, a gradual loss of organ reserve, and a higher risk of several cancers. At iThriveMD, we pair advanced diagnostics with a suite of therapies including peptides, NAD therapy, IV nutrients, hormone optimization, and additional personalized lifestyle recommendations that we make sure optimize your ability to prevent the scourge of modern diseases like cancer, heart disease, diabetes, and dementia, almost all of which are highly preventable. All of this can be delivered as an individual interventions or as a membership model that gives you ongoing access, continuity, and support instead of one-off visits.